Hi, thank you for connecting with us today at Faces K Ready Ohio. Today we're going to talk about kindergarten and specifically how to know if your child is ready for kindergarten. And there is more to consider than just the age of your child. When kindergarten teachers have been surveyed, they say that emotional maturity and independence are far more important than pre-academics. Here are some questions to ask yourself in regards to your child's readiness for kindergarten. Now keep in mind, your child is 5, maybe barely 6, and so we wouldn't expect children who are 5 or barely 6 to be able to do these things all day, every day. Yet we would expect children to be able, at this age, to be able to do these things for some or most of the day. So here we go. Here are some questions to ask yourself. Can your child play cooperatively with other children? Take turns and share. Can your child communicate their needs to adults, their teachers, their peers, using their words and not their hands to solve their problems? Can your child self-regulate their emotions and/or their impulses without a lot of adult support? Does your child exhibit independence? I would say independence is huge as children transition to kindergarten. Can they follow simple directions? Can they take care of their bathroom needs? And can they easily separate from you? Can your child sit and listen for an extended period of time? There is a lot of sitting and a lot of listening in kindergarten. And this can be very different than how they spent their days in an early childhood program and/or in a home setting. Now, 2 final considerations to think about. I know I said earlier that while age is important, it's not the only thing that's important, but there is one consideration when it comes to age that you may want to consider. And that is that if your child is going to be younger than their classmates and your child happens to be a boy, then you may want to consider waiting a year. Studies show that younger children are sometimes misdiagnosed, confusing immaturity with symptoms of ADHD. That will all play itself out as they grow into a more mature version of themselves. And the other one is if your child has a diagnosed developmental delay, learning disability, it may not be best to hold them back, because the research is clear that the earlier children get support, the better their incomes. You've heard that theme over and over again in these vignettes, and that is that early intervention is often the best prevention for having a lifetime of learning challenges and difficulties, because your child's not going to outgrow a diagnosis. What can happen as a result of getting those supports is they learn how to adapt to and overcome those challenges. If you're unsure about any of these considerations, always reach out to your pediatrician and/or the school district that your child will be attending for further guidance. As always, we're always grateful for you connecting with us at Faces K Ready Ohio.